Okay, so we have Dr. Peter Sundwall with us today. We just finished our rounds discussion, which was excellent, by the way. We're grateful
Thanks.
to have you, and we got to learn a little bit about the perspective of family medicine, which is unique for us. So we're grateful to have you here. I think it would be great if you maybe started telling us a little bit about your background, which is unique because your family, you come from a lineage of primary care providers.
Yeah, I mean, fifth generation family med doc, so no pressure whatsoever to choose family medicine. I actually worked really hard not to be family medicine or actually go to medicine at all. And so I always tip my hat to people that had no medicine in their background and they chose it. I thought that was super awesome. But I just remember growing up hearing, very interesting rural family medicine stories. It was part of my family, who they were, and I think secretly deep down in my unprideful self that I was, I'm probably gonna want to do this. And so, like, even when I went to University of Utah Med School, I was like, I'm gonna do something different, right? I want to do something like sexy, like ortho or neurosurgery or something, something like that. And I guess the genes kind of caught up to me and realized this is really what I want to do. And so, it's been a great opportunity. I've loved it. I work in Sundwall Family Medicine. We're not really creative, and so we're like, we'll just use our name, I guess. But
it's good branding.
Yes, I guess so. Yeah. But I work with my dad. He's still practicing. He does a great job, and it's been awesome. It's worked out pretty well. There's always that, scary thing like, do you work with family or not? But in this dynamic, it's been pretty good. So I'm grateful for it.
Yeah, that sounds like a great environment. Who else is part of your staff? Who else is in your office? How many providers do you have?
Yeah, so it's my dad and I, and we have three physician assistants, assistants. They're awesome. They're incredible, and so we're so grateful for them. And we are growing. I don't know if what we're really working towards in the future as far as how big we want to go, but we have awesome staff. We have awesome patients, and so we're super grateful for the people that we've had, because it definitely makes my job easier when you actually enjoy seeing people, and we've had incredible people.
That's great. Yeah, and it was enlightening for me, even as another healthcare provider, to hear some of the unique challenges that you face in primary medicine and family medicine. Tell us a little bit about some of the common things that are obstacles for you guys specifically that maybe the rest of the community may not be accustomed to.
Yeah, I think it's always tough because we're womb to tomb care, right? Mm-hmm. And so we kind of see anything under the sun. It's a Pandora's box. Really, somebody says like, hey, I'm here for, an annual wellness check or annual physical or whatever, like that's kind of anything. I usually ask them, can you just lead with chest pain and not do a by the way chest pain at the end of the visit, But we just see a lot of variety, and that's kind of why I kind of chose it. I still see it a lot. And I think what's particularly interesting is I have to understand my limits, especially in this awesome community with incredible specialists around. It's like, you know what, I don't feel comfortable with managing this, and time to send it off to you guys. I also don't want to be a straight up referral basis where like I'm just referring everything, like, high blood pressure, cardiology, and like GI stuff, go to a gastroenterologist, and like back pain, see neurosurgeon, so it's interesting how we can actually take care of a lot of different things that we can help you get the right cases for you that are the most meaningful. Not that I'd ever hold back anybody from seeing a specialist. If they want to see somebody, they can see somebody, of course. But that does pose a challenge because triaging what is most important to the patient and what is most important to me as their provider and what is most important to the insurance company is very tricky. And so you kind of just base it off of what you feel like is the most important to the patient, and hopefully help them realize that too. And it gets tricky. I think the case that I brought up was kind of a normal complex guy with multiple, chronic medical conditions with blood pressure, sleep issues, mental health stuff, wanting to talk about weight loss. And then it was by the way, at the end of the visit, right? I have this knee problem and it's, I just want to know what it is. And, to fast forward, it ends up being a septic joint, and that's tough, right? When you're 40 minutes into the appointment and you're running late, like what do you do? Do you just postpone it, right? Just, so it does pose a challenge, but, it was a problem. and you have to take care of it, and make it work. And so those are hard challenges. And what also gets challenging too is like, how do you communicate with specialists? I think that's really important for me. I'm just like, what is the best way to do that? Do we send a fax? Hopefully we get them in the next day. Do we call you? Are we okay to do that on the cell phone? Are we that close enough to be able to do that? And so I'm grateful for Summit to be able to have that opportunity where I can just text Dr. Pitts or Edwards or you guys and just be like, hey, like, I have this patient. I'm worried about them. They're not wanting to go to the emergency room or kind of do the care they want. If they hear it from you, I think they'll be more willing to do that because you're the specialist. And so that's been incredible. But that's a challenge every day. Yeah. Makes it fun.
Yeah.
Makes the day go by fast.
Yeah.
But it's definitely hard.
Yeah. Yeah. And you brought up the phrase that we commonly hear and commonly use is many minds, better outcomes.
Yeah.
And I can't think of a better place where that's implemented than primary care medicine, like you're alluding to, is that you guys get to see basically every diagnosis under the sun, usually a first contact for the patient, and then you get to really collaborate with all of the community around here. How has that influenced you as a healthcare provider and in establishing those relationships?
Oh, it's awesome. I mean, I think, like a good example is actually walking down the street actually this week, I mean, it's a nice normal neighborhood, I like to think, but I see plenty of patients that are neighbors and friends, and you definitely have to work on boundaries there. But, I just had this lady grab me as she was walking. I was walking with my kids, and she was out walking, and she said, hey, thank you so much. I've never had somebody really look at my knee the way Dr. Edwards and Dr. Pitts have, or and she was thankful for me, thankful to me for it. And I sent a text to them saying like, hey, thank you so much. And so having a great specialist, having a great community of different kind of physicians that I trust makes a world of difference for my patients. It makes me look better too, but because the primary care, like they can be, I think people go to primary care because they want to establish a good relationship with somebody that is good. And when you send them to a specialist, you're always a little anxious, right? Like, are they going to treat the patient well? And sometimes, I mean, classically, like with a surgeon, it's like, I don't really care what their bedside manner is, they're a great surgeon, But I like both because the patient has to be listened to. They have to have their name being said to them. They have to be touched physically appropriately, and just, I think if we miss that old school kind of like aspect of it, even in the specialist community, the patients always come back and say, they didn't listen to me. They didn't even touch me. They just looked at my MRI and said, no surgery or surgery. And they're like, I'm not going to trust them to have anybody else. That comes back to me, and I know. And I've gradually kind of like said, probably not a good fit, is a good fit. And I'm sorry, I don't want to toot the horn of Summit, but every patient's come back saying like, hey, we really appreciate what they've done for me. And so, yes, that really has influenced my way of primary care, is having great specialists in the community.
That's great, yeah, and similar from our end, we know that a patient that's coming from a great family medicine clinic is going to have really their needs met, and then we can just be a small piece to add to the puzzle, knowing that overall they're getting great care. So we also appreciate the relationship the other way.
Yeah, well, thank you.
Yeah.
We appreciate it. I think it means a lot to send them, even like to physical therapists and every provider, just to know, hey, we're all trying to make the patient have a good experience and to improve their health. I think when, classically, I think the emergency department gets thrown under the bus and like, oh, they didn't do this workup, or, they didn't do that, and how come, it's just like, there's so many variables in there where I never can feel like, I can't blame any other provider for doing something that the patient felt like they didn't get, because we don't really know what kind of happened. And so I always get, like, gosh, I hope neurosurgery is okay with me sending this patient and the workup I've done or the workup I've not done, because the patient said, I don't want to work up, let me just talk to the specialist. Or like, I want everything done, I don't want to see the specialist until I really need to. And so it's a big dynamic of like, gosh, I like really try to stay evidence-based, but sometimes the evidence is thrown out the window sometimes,
yeah.
And like you don't want it to be, but it's like, okay, here's the referral, hopefully. And with some, it's always been like, I know you're going to get taken care of, and I know they're going to call me and hopefully teach me and help me become a better provider, or they're just going to be grateful for the consult. And so that's been really nice.
Yeah. Well, that's great. Well, we won't take up too much more of your time. I know you're busy. As we just learned, you got a lot going on. That was a fun little quirky video that we got to see that paints the quick picture of everything that family medicine does. But we're great for Dr. Peter Sundwall, excellent staple piece in our community, providing excellent care for our patients. So we're grateful that you took the time to spend with us.
Well, hey, thanks a lot, Alex.
Yeah.
Appreciate it.